Spring has sprung, but more than flowers popping up, it's more cases of COVID-19. Every passing week has starved sports fans wanting to get back into the bleachers for a game and parents wanting their kids back into the classroom. The big question for most is, can we reopen? But to paraphrase Jurassic Park, as people are preoccupied with if we could, they haven't stopped to think if we should. Welcome to the Huddle. I'm Brendan Kownacki. Thanks for tuning in. We've got Marc Ross with us, of course. Marc, we finally have got the confirmation of a new HHS secretary, which is good news in this pandemic equation as we're tracking the virus once again here in month 13 of the pandemic. But it seems that the crowds of people in Miami Beach may have missed the update. I don't know what's going on out there, but we're talking about COVID-19 again this week. Marc, tell me what you're seeing out there.
Let me tell you something. I love Miami Beach. I love South Beach. Actually had my bachelor party there. That's off the record. But it's a great place to hang out. But is it a great place to hang out during a global pandemic? I don't think so. The Clevelander is being overrun. The streets are being overrun. The people are dancing with no mask. And the city of Miami Beach, took the bold step of shutting down the spring breakers. But as you say, what are we doing? Why? We can do this, we can get out and about, but why are we doing it? We're still facing a pandemic, but the message hasn't gotten broadcast to all our citizens.
We mentioned it last week, but in Europe, they're seeing the serious ramifications of opening too soon. I had mentioned that Jurassic Park quote from Jeff Goldblum, but it's a serious ethical and logistical question. Just because we want everything to reopen quickly, we want to be back to normal, that doesn't mean that we're fully ready to do so. Surges across the continent in Europe have caused these new lockdowns to come into place on city and countrywide levels. The AstraZeneca vaccine, even though there's questions about its efficacy and its safety about blood clots, is being put back into practice because Europe feels like they need to tackle this issue head on. What do you think? It's not just the United States that's grappling right now.
Yeah, no, I think we're a few weeks from obviously the important Christian holiday of Easter and the Jewish holiday of Passover. And, both France and Italy have taken drastic steps to shut down their economies in different phases. I think there's a huge fear, just like we saw in January, of having a huge flare-up post-Christmas when families get together, a lot of traveling. So pretty aggressive steps that countries in Europe are taking to hopefully quell what some are calling a third wave. What's interesting about the vaccine, there were 17, I think, countries that shut down the use of AstraZeneca in some fashion, but the EU Healthcare Authority, I forget their name, they gave approval. But what's interesting about this is obviously the vaccine diplomacy, the soft power, the ability for nations to almost look for a perfect solution when this vaccine might not be perfect. There are challenges to it, but it's better than nothing. So it's amazing that the Europeans have kind of slow rolled this out and really forced the slow distribution of a seemingly wonder drug.
Our guest last week pointed out that the vaccine is really focused on trying to eliminate the serious cases, the ones that will lead to hospitalization. And so while there are questions about, 100% effectiveness and things like that, we have to say, if the vaccine is bettering the overall picture, if it's stopping those deaths, if it's stopping the serious hospitalizations, then we need to put this into practice if planet Earth is going to survive. I know that on the vaccine front, you've been looking at some of the global numbers that have been released to show just how other countries are doing. President Biden was very optimistic about our rate of vaccination. It's not happening quite as fast everywhere else, is it?
Yeah, Bloomberg released this amazing graphic tracking how long it's going to take to get 75% of the population vaccinated by country. Obviously the most progressive, most economically developed nations, UK, US, we're looking at 5 months, EU as a union looking at 18 months. But the BRIC nations, Brazil, India, China, Russia, they are looking to 4, 5, possibly even 6 years to hit 75% of the population. I was absolutely godsmacked. 5 years from now is 2026.
And that's assuming that everything stays exactly on plan as it is now. If there's a single backslide or anything, that number only extends. I know in that Bloomberg study, it said 9.9 million doses are being delivered a day pretty much globally. And at that current global rate, it would still take about 3 years to get to a global 75%.
The underlying implications of this, you're clearly going to have two-tier societies, right? There's going to have to be vaccine passports or for people who can travel and conduct commerce and business and even travel to see friends and family. But this two-tier approach of very challenging countries like India, Russia, China, where public demonstrations and strife are always around the corner. The idea that it's going to take almost 6 years for China to hit 75%, and to your point, even that's if everything goes perfectly, is completely. I'm like really startled about this. Like this is like a huge challenge. We're so focused, as you see in South Beach, Miami. Hey, we're back. The Texas Rangers. Let's everybody in. Let's play ball. It's opening day. Major League Baseball. Everything's back to normal. No, there are still huge challenges that we need to discuss.
Yeah, that reopening challenge is definitely what we wanted to dive into further today with our guest. Last week, you spoke to Dr. Mark Stellingworth, a cardiologist in South Carolina, to look at the 1-year anniversary of the COVID pandemic. And this week, I'm going to speak to another expert doctor, this time in Maryland, to analyze the puzzle of what it's going to take to get our businesses and communities reopened safely and effectively. Let's take a look. Dr. David Marcozzi, thanks for joining us today on the Huddle. You have had many different roles throughout the course of your career. You're very accomplished, if I may say so myself. Tell our viewers a little bit about just the different roles you had, and they can understand a little bit more about your perspective as we discuss the COVID-19 pandemic.
Roles. So I have a few. I've just assumed the new role as the University of Maryland Medical Center's Chief Clinical Officer, and I just started that this week. In addition to that, I serve on Governor Hogan's task force for response and recovery, and I've been doing that for the past through a large majority of 2020. And towards the end of 2020, I was named as Governor Hogan's COVID-19 medical advisor. And fundamentally, though, and at the cornerstone of who I am is that I'm an emergency physician. As a practicing emergency physician, I really think through that acute care phase of when people get ill and injured, and how to appropriately treat them. And my last role, not to say that I've got too much on my plate, but I'm currently a colonel in the United States Army Reserves.
I was going to say, you've been in the military. You've advised at least 2 presidents that I know, and always, though, a doctor in the emergency room through it all. How have all your different experiences helped prepare you for what was probably a very intense 12 months that we've just been through?
Well, you're right. I mean, for all of us, it was interesting to be a part of something that I had, been working through the Bush and Obama presidency around pandemic planning, around emergency preparedness, and emergency preparedness specifically for healthcare delivery. I've been, on the ground at 9/11 up till, thinking through policy at the White House, and all of those perspectives helped me as an individual think through the challenges that we saw and continue to see for COVID-19. So as an individual, I knew I had some perspective about what to start to expect. Professionally, the level of intensity and the courage and fortitude that it took from all of our team members to respond to this event was certainly something I learned through this, and the ability to stand up, step forward, and continue on through this. The stamina that it took for all of us to continue on professionally was something that I did not appreciate when you're doing the planning until you're really in the fight. And once we got in the fight, that was something that really, that I think that everyone who I was involved with demonstrated such just personal fortitude to continue on. The old expression, Brendan, when you're going through hell, the only option is keep going. And I think we saw it through this response.
Yeah, just 12 months ago, we were hearing about COVID-19, the coronavirus, for the first time. This was an education for a lot of people just on what even the threat was. We were tracking daily infections and then deaths. Just 12 months later now, though, we're tracking vaccinations. We're tracking a very different perspective, is a word you used. How do you think we should look at things now? Have we turned a bit of a corner?
So we're in a two-front war. One front is the continued need to respond to those who are ill from COVID-19, and not just those who are ill. How do we stop the viral transmission so that less people become ill and more people are healthy? The other front is linked to that, which is our vaccination front and the unbelievable efforts that are undertaken. You need three things when we think through that vaccination effort. The first is you need vaccine. And we obviously have three. We hopefully will have more. The second is a chassis that a nation, a state, a health system utilizes to vaccinate. And then you need a third piece of the equation, which is individuals like me and you interested in receiving the vaccine and not hesitant, well-informed, understanding the data to drive their own decision around vaccine uptake. So those three pieces need to be put in place for the eventual deliverable of our nation vaccinated appropriately against COVID-19. So you're right, it's a two-front war. We are still, no one should be claiming mission accomplished. We are still squarely in this fight on both fronts.
You mentioned about people being willing to take the vaccine. Obviously, this vaccine was developed rapidly, but it still represents science at its best, which is, a lot of man hours, a lot of testing. But we've seen social distancing, we've seen lockdowns, we've seen debates over whether or not masks are good science and whether they actually help prevent this disease. Why is it hard for populations to embrace the advice of the things that are going to help them save themselves in a scenario like this?
Yeah, it's a great question. So, at its core, why would someone be hesitant to get a vaccine? And that's really, why would I be reluctant? And particularly, why would we see reluctance for individuals who may be at higher risk? And that is a genuine concern of mine. So we will not win this other piece. We will not win the fight unless we not only vaccinate as many people as we can, but also vaccinate those who are most vulnerable, and particularly our Black and Brown communities, understanding the threat, the risk, understanding the risk to their health and families, and then understanding the data that can appropriately inform folks are key pieces to this second front that we're embarking on. Why might individuals be hesitant? Well, a lot of people that at least I talked to were concerned because it was rushed. And that's the majority of, we really don't, it sounds as though it was just very rapidly done and we don't understand that why was that so fast? Because it should take longer, shouldn't it? Fortunately, I think that we have an answer to that. And the answer simply is, government got out of its own way. Two things were fundamental. One, is the vaccine safe? And then, is it effective? Yes. The third piece, which requires vaccine development historically, was a lot of administrative burden to allow those vaccines to be developed. And that third piece was streamlined. So then you only had to make sure that it was safe and effective. That's a good news story. So we actually got more efficient as a nation to think through those safe and effective vaccine developments. But around messaging, that's a concern. The other is that folks have is around understanding the data and understanding the long-term effects of the vaccine. And the truth is, I received Moderna, and I'll talk about side effects because that's the third piece that I'm hearing a little bit about. And I understood that the vaccine has 4 components: lipids, sugars, a buffer, and mRNA injected into me. I looked at the data to understand what those things might be. Would they affect my health? And then thought through it and looked at the risk of COVID-19 and my risk, and then the risk of those ingredients. And I weighed those pros and cons and realized that the risk of getting any of COVID-19, to me, over 50, having potentially higher risk as we get older, we're more vulnerable, was much more significant than any risks associated with the vaccine. The last piece that I hear is a concern is around side effects. Oh, geez, I really don't want to get the side effects. In fact, one individual I work with asked me, what did I get? And I was transparent. And after this conversation, he elected to get it. So first shot, felt it in my arm. Next day, hurt a little bit, went away. Second shot, a little bit fluey, felt a little bit aches and pains, went to bed earlier that night. Next day, felt fine. But let me be honest, a lot of people are concerned that they're going to feel worse through this. And my perspective to them is this: a 24-hour feeling a little bit of fluish is a heck of a lot better than getting ill from COVID-19.
Obviously, the severity and the way that different people's bodies have reacted to COVID has been one of the problems across the board in treating this disease. And so I agree with you 100% that we have to be able to weigh the positives versus the negatives. One thing I want to ask is along with that, though, the vaccine isn't a catch-all, cure-all, though. We do still need to look at things like masks, though, and until we're out of the woods, so to speak. Can you talk about why it's important that as we're in this vaccination phase and those numbers tick upward, that it's still important, though, to practice good habits, wear a mask when out in public?
Yeah, so I'm a very big mask proponent. Let me first say that. I think that the science is clear that it mitigates the spread. So what you're trying to do with a virus that's moving between person to person via airborne is stop that spread. It may not prevent all of it. A certain mask may only prevent 50% or 25% or 75%. But you know what? That's a lot better than 0% mitigated and slowed. So it is important to understand, and I will continue to say this, that mask wearing is critical to slowing the spread of this virus. Whether or not it's the 100% mask, 50% mask, 75% mask, whatever you do. And that I'm wearing a mask, and I literally have mine right here. Don't touch the front of my mask. I touch the sides of my mask. I take it on, put it off right there. I wash that second mask. I put it on just to make it a little bit more, socially acceptable or cooler. But vaccine. The vaccine, as we understand it right now, there's the data is starting to inform this decision. So as this point in time right now, we think that certainly vaccine will potentially limit or lessen the amount of virus that we have if I get infected to be able to transmit it. However, it's not 100%. So why wouldn't I try and lessen it to as much as we could, all of us, to continue to wear a mask until this virus is such at a low prevalence, it no longer is moving between people because we're all immunized. Until we hit that point, in a disaster, in a mass casualty, in a public health emergency, which is where we're in presently, you want things that are simple, cheap, and effective. Simple, cheap, and effective.
Yeah, I mean, you raise so many good points. Obviously, masks are not a foreign thing to be seen in hospitals for many years. So why wouldn't we immediately think that for those same reasons why nurses and doctors wear masks during surgery or medical procedures, that we would be using the same calculation when we're trying to stop the spread of infection between individuals in the public?
I don't think masks are a political statement. I think masks are a demonstration of respect. So if I'm wearing a mask and the other person's wearing a mask, it's almost like, hey, thank you. Thank you for protecting, because that person doesn't know, or I don't know if I asymptomatically have this virus and I could potentially spread it. So to me, it's almost like a handshake. It's almost like a mark of respect between individuals. And during a public health emergency, the unbelievable importance of unity, of respect for each of us, and demonstrating a mask, simple, cheap, and effective, as a sign of respect, I think we can all get behind, and I think we should.
I want to pivot off that and say, tell me about the hospital experience of your days in the emergency room over these past 12 months. We know that hospitals were overwhelmed. Initially, there was a lot of conversations about masks and PPE, whether there was enough. And then over time, hospitals learned lessons and were able to stabilize their care practices a bit. Tell me just a little bit about how you've seen the progression in your hands-on work in the hospital.
I remember early on when I saw a patient who had come back from overseas, who was demonstrating flu-like symptoms. And this is before we even had testing. And I said that we went through phases. It's almost you could write chapters of a book through this response, where we went through, the unknown when we were really concerned and really didn't know. And then we went through it's definitely here phase. We went through PPE shortages, testing shortages, bed shortages. So with each surge, there's always potentially bed capacity limitations in our hospitals.
Right.
And we continue to work through that. And then we kind of went through these different chapters of, that got a little bit lessened through the summer. And then we had the concerns around the fall and the winter with regard to the second surge, and mask wearing always being a point of discussion through it, shutdowns and openings, and now vaccination. It's amazing as the book gets written in years to come, how those will be different chapters of the challenges we all faced. And thread through all of that, woven through all that entire construct, is the emphasis around mental health, because the importance of understanding defining a person's health, not just of their physical health, but also their mental health, and the isolation, the social isolation that we had due to this virus, is certainly something that we need to think through in the years to come and learn from.
Mental health, I'm really glad you've raised that. That's an area that I've done a lot of work in when it comes to both the veteran populations, civilian populations. I know we've seen an uptick in people battling their own addictions because of the isolation and what they were faced with when they were sitting at home under this stress. What about other tangential health issues when it comes to heart attacks or chronic conditions like diabetes or anything? Have people been neglecting those conditions because they're scared to go to the doctor right now? They're scared to seek help when it comes to other medical need?
Let me talk about a little bit of the mental health effects. I think from a communication standpoint, we got in front of our skis on one piece. I think we probably should have started to say, as opposed to being socially distant, we should have said physically distant, but socially connected. We should have always used those two as a pairing. Physically distant, which means I'm not transmitting the virus as easily between individuals, but socially connected through telephone, through email, through any type of other means, electronic means or even a hello through a doorway, or through the ability to make sure you're continuing to be protected. That socially connected but physically distant would have been a better message early on, and I continue to kind of talk about that. But I'll be honest with you, Brendan, I lost a friend during this pandemic, not to COVID-19, but to the mental health impact of COVID-19. And he
sorry to hear that.
Yeah, well, thank you. He committed suicide, and it was a moment of pause for me to recognize that, it was a teaching moment for me, is something that I'm going to take away from his death, that it made me, in the middle of a response, pause and assure that mental health became part of our daily conversation. And Brendan, you talked about our veteran community. They've been grappling with this for years, and it was tangible to me during this response, and it continues to be something I make sure that I talk about when I'm having conversations just like this. I think a lot of people early on, when everyone closed the door, stayed inside, needed to do it to slow the viral spread, got it. And also people started to have concerns about going to the doctor, because that means when going outside your house, a potential another exposure. I'm going to a doctor's office. Is that doctor's office able to protect me if I walk in there from anyone who else is in the office who's potentially has the virus. So a lot of people potentially didn't seek care for diabetes or cholesterol or heart disease, and they potentially suffered the effects of that. You don't want to survive COVID, survive this pandemic, but suffer the untoward events or effects of another illness. We want to maintain our health for all of our illness, including COVID-19. And I'll be honest with you, at the University of Maryland Medical System, early on, our infection prevention specialists went to every ambulatory care practice, every primary care office, and said, this is what you need to do in your office to stay open, to keep your staff protected, to keep your patients protected. And they had full PPE, they had full testing procedures, all to assure that as those practices opened up, that they were able to maintain the care delivery for those individuals. But what we're seeing, Brendan, to your point, is people waiting. They're waiting to see those individuals, to see their primary care providers, and they're suffering untoward events, and they're coming to emergency departments, our emergency departments, because their illnesses are more critical in nature. And if we took that primary care step more, and individuals like you and I went to see our primary care doctor just like we should, then we would mitigate some of these untoward health effects. One thing that's helpful is telemedicine, right? We're seeing a boom of telemedicine. So now I could be just like you in my home, see a doctor through Zoom or FaceTime, and I can get recommendations with regard to my health, change in prescriptions. They can see a rash that we didn't have before COVID-19.
You brought up this idea of being socially distant, and like you said, that maybe that messaging was off a little bit. It started out, we were hearing it a lot in March, April, May, June, that we were alone together, we're in this together, that word together. And then we've come off that a bit. But I know when President Joe Biden marked the 1-year anniversary of this, he brought up this idea of togetherness. It is going to be all of us together who tackle this. We were initially having conversations about herd immunity based on the number of people who were infected, and maybe we go over this. Now it's a conversation about getting enough people vaccinated, and that maybe another doctor had said to me last week, he said, the combination of the number of people who've been infected plus vaccinations now, we might be closer to herd immunity than we can officially gauge. And so, do you think that there's something to that if we try to encourage more of that togetherness, that we'll be able to get over this next step?
We don't want to get into political conversations, but all disasters wind up becoming political, unfortunately. Right. And as an operations guy, as a guy who at least focuses on what ideal response might look like, it is always challenging when either the D's or the R's, and having worked for both administrations, a Republican and a Democrat, it is always a challenge when there is political infighting with regard to disaster versus looking at a unified and a joint approach to how we can best mount our response. So to that point, I would simply say that we are stronger together, and it seems trite. But what I would focus on is unity. We, as a unified front, we have the better ability to lessen the health effects of this virus, and more to maintain more of us being healthy for the next few weeks and months.
Governor Hogan in your state of Maryland said just yesterday that he thought some states are rushing to reopen a little bit, but he's hoping Maryland is not one of them. As we're looking at reopening metrics, how do we make sure we don't have a big backslide? How do we know what's a safe and effective way to say, well, we can have 25 or 50% of people in restaurants. We can have this many people in Camden Yards. How do we look at those metrics and make sure we're being both cautious but optimistic?
Yeah, let me circle back to one thing you were just talking about, Brendan, before, that my colleague, you said you interviewed a doctor, and I'm going to get to how we can be cautious in the go forward. The physician you were speaking to mentioned, we could be closer to herd immunity as a result of a lot of asymptomatic individuals having immunity, and also those who are being vaccinated with known immunity. I would agree. The only challenge to that theory is that we don't know how long, if we are infected from the virus, how long that immunity lasts. And what we're seeing in some of other countries is either we're seeing variants and a reinfection. So we don't know if it's the variant causing reinfection or the immunity wanes and then you're getting reinfected. So there's a cautionary tale, which is where I'm going into my next part of this conversation, to make sure that immunity, we understand the data and the science to understand, and I think we're going to need it. What does booster vaccines look like, and how long does immunity last to assure that we are all protected? That's another reason to bring back and circle back on our earlier conversation to continue wearing masks. Now, on the conversation of how do we reopen, and yes, you're right. We're seeing different areas across the country and across the world reopen, and now we're seeing a pivot. Look at Germany, look at Italy, and look at France and Paris. We're all seeing now they're starting to close back down because of an increase in the amount of case positivity and potential healthcare impacts. What we need to understand is now in this two-front war, case positivity, and if we are able to largely vaccinate our vulnerable population, may not necessarily be as well correlated as they were previously. So if we were able to do 100% vaccinating, we have ways to go before we get there, of our vulnerable populations, then the opportunity then is our case positivity rate ideally is low, but as it continues to fluctuate, we may not see as much of the healthcare impacts or those suffering from this virus, the ill effects from this virus as much, because they're protected due to the vaccine, which is why the vaccine front is so important now. But let me just say this. Some of the variants are potentially may affect different populations. So potentially younger populations becoming more ill, or different acuity of the virus, so becoming ill faster, or potentially spreading easier. So this is not something we take our eye off the ball. We need to continue to you hate to say it, we need to continue to fight back. This is not something where everyone goes, we're done. We are, for the next 6 months, don't let up on the gas.
Yeah, that's certainly, you mentioned it, France, Italy. France announced this morning that they're going to a 4-week lockdown. Italy is locking down into the Easter holiday. This is certainly a time to stay sharp. We don't have all the answers. And as we learned early on, this wasn't going to be a weeks-long discussion. It's going to be something we have to watch for a while. Is this a virus that can ever be eradicated? Or is this something that maybe like the flu, we'll be facing shots yearly, we'll be looking at preparation for a long time? The
beauty of being an emergency physician is these are some of the questions I might phone a friend for. I do listen to some of our smart epidemiologists here at the University of Maryland and across the nation, and there is a lot of suggestion, at least from what they're speaking about, that this will move to more of an endemic phase, right? COVID will become part of us, just like flu will become part of us. And let me be honest, flu deaths amount 30,000, 40,000 or more a year. So flu is part of what the fabric of how we live, unfortunately, and flu deaths and mortality is just something we all just accept. We don't need to accept it. But now on top of that, we need to think through COVID-19 will be another challenge to our health as we go forward, and that may just become of who we are as a civilization.
As we wrap up, I just want to ask, what's your prognosis? Are you feeling more positive than you were 12 months ago? Do you feel like we can get through this?
Yeah, as an emergency physician, optimism is, I'm always cautious with optimism, right? So, but let me just say this, I'm optimistic. And I'm optimistic for a few different reasons. First, the challenges we saw in the beginning of this with regard to personal protective equipment, with regard to testing, with regard to surge capacity, with regard to our ability to treat individuals. We now have monoclonal antibodies. We now know dexamethasone is helpful. We now know proning is helpful. How to treat individuals suffering from COVID-19. Vaccine is rolling out. We are now moving to the ability to move outside again. This virus doesn't like being outside. It does not transmit well outside. All of those things create in me a degree of optimism. But that said, one preventable death is too many. And we need to make sure that we, as you said, Brandon, stay sharp and don't, stay in the fight so that we don't let down. Don't let your foot off the gas when we're so close to getting to a point when normal or getting back to some degree of normal is what we all want and can expect for the next few, in the next few months. And if we do that collectively in unity, the faster we'll get there.
Dr. David Marcozzi, I really do want to thank you and your colleagues for your service this past year. I know you're very humble, but I do want to mention that I saw that you were named Physician of the Year by the Maryland chapter of the American College of Emergency Physicians. Congratulations on that honor and for everything you and your team have done to keep the people of Maryland and the United States safe. Please stay safe out there.
Brandon, thanks for all you're doing. It's great to talk to you again. To everyone out there, wear a mask and get vaccinated. Thanks very much.
Brendan, that was an amazing interview with Dr. David Marcozzi, obviously a true professional on the front lines. His commitment to service, not only in this current pandemic, but also working with past presidencies and his service in the military. Unbelievable. Lots to learn there. Things I took away from it. There were two things, especially from a communication standpoint, just that we should have been using the word physically distant, right, and socially connected. I thought that was super powerful. Lesson learned. And this idea of like when you're facing a pandemic, you're facing a two-front war, you want solutions that are quick, easy, and cheap, and there's nothing better than a mask. So I thought it was a real powerful interview and a great capstone. It was really great. I thought to have Dr. Mark Stellingworth more working on the rural side, at a hospital level, and then somebody working at the strategic, national, even statewide level, trying to sort out how to respond to this. Great job.
Just to get these different perspectives to really understand how this war against the virus is being fought place to place. Because again, it's not something that's hitting one community. This is a global issue. So you have to imagine that there are people all over the country, like Dr. Marcozzi, like Dr. Stellingworth, who are facing these same challenges, asking these same questions every day. So Mark, one last thing before we go. It's that time. Let's talk about who you want in your huddle this week.
So I'm going to go left coast, best coast, west coast. I'm going to go with Donald Penn. He signed a one-day contract with the Raiders where he retired. Why this is so interesting, Donald Penn, 14-year veteran of the NFL as an offensive tackle. He grew up a fan of the Los Angeles Raiders. He signed this great one-day contract to announce his retirement. I love the one-day contract. I'm still waiting for mine for the Detroit Pistons, but maybe that'll come someday. The one-day contract, he retires. He shows up at the retirement ceremony in a custom-made T-shirt with his face superimposed in the iconic Raiders logo. What a total baller. Congratulations to Donald Penn. Enjoy your retirement. Brendan, who do you have in your huddle?
This week, Mark, I am picking Secretary Pete Buttigieg, along with his husband, Chasten. There's been some great news coverage in the nation's capital about this couple and just their efforts to try to settle into the Washington, D.C. community as they've joined this area with Mayor Pete, now Secretary Pete, becoming the new Secretary of Transportation. I think the best story which I've seen is that it was first reported that Pete was seen riding a bike share bike, which was amazing to see the Secretary of Transportation using a rental bike. But then stories came out on Twitter that a gentleman who was selling bicycles on Twitter actually is waiting to deliver a bicycle to somebody in a Pizza Hut parking lot and finds out that it's the new Secretary of Transportation who's coming to buy the bike. And so I think this is really a message for us that our government are people too. They are citizens just like us. You've said it before. These are people who come from our citizenry. The president is selected from our citizenry. And so just like everyone else, new to town, trying to find some things, buying stuff on the internet. It's a little levity just to remind us that we're in this together.
Absolutely love it, bringing those small town, Midwest, South Bend values to the big city of DC. And there's got to be some kind of pun there, where if you're walking the walk or walking the talk, riding the bike, I don't know. But I'll leave it to the Department of Transportation to come up with some good segue there.
Absolutely. We will work on those jokes for next week. Mark, you have a good week. I'll talk to you soon.
All right, Brendan. See you soon, buddy.